Hello, everyone. Thanks so much for taking time out of your day to join us for today's Needy Med special topic webinar, presented by our partner, $4. Charity Care 101, how to get your hospital bills waived. So thanks for being here, everybody. My name is Carla. I'm the Director of Education Initiatives at Needy Meds. And like I always do, before we kick off today's presentation, I'm just going to offer a few tips so you can make the most out of it. First of all, we of course encourage you to ask questions at any time throughout today's presentation. And you could do so by submitting questions into the Q&A or the chat section of your Zoom control panel. Don't hesitate to do that. Just know that we will reserve answering questions until the end. And if we don't get the chance to answer your specific question, we or a team member will follow up with you by email. But of course, we also encourage you to visit our websites and reach out to us if you need to get more information sooner. So with that, let's get into what Needy Meds is before we dive into today's topic, just for those of you that are not yet familiar with us. Needy Meds is a national nonprofit, and we were founded about 25 years ago. And what you're looking at on your screen is the fancy wording for our mission statement. But simply put, Needy Meds connects people with healthcare savings and educational programs. And we do that free and anonymously through our website, needymeds.org, and a toll-free helpline, 1-800-503-6897. So let's transition right into why everybody's here today, how to get relief from hospital bills. Now, as you saw a couple of screens ago, a big part of the Needy Meds mission, in addition to connecting people with healthcare savings, is also sharing other resources that will help them on their health journey, which is why we are so proud to have our partner from $4 here today. So first, let me tell you a little bit about $4 if you're not yet familiar with them. And it's our pleasure to introduce not only you to them, but hopefully after today's presentation, you'll share $4 with your loved ones, friends, neighbors, and patients and clients. So $4 is a national nonprofit like Needy Meds, and basically they crush medical bills. And they do that by helping patients access charity care. They empower patients and advocate on their behalf by making sure that they even know charity care exists and making it easy and fair to access. So I'm really excited to have this resource to share with you. And we are fortunate enough to have $4's Chief Operating Officer, Elise Goldstein, here with us today. Now, Elise believes that medical crises should not lead to financial crises, which, I mean, that you couldn't say better, honestly. And she is absolutely on a mission to crush as many medical bills as possible. So with today's presentation, Elise is going to explain all about charity care programs that most hospitals offer, which provide patients with discounts or bill forgiveness. And importantly, Elise is going to share how you can get free help applying. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the screen to Elise. So Elise, why don't you see if you could go ahead and grab that screen? Perfect. And we can see you and that PowerPoint clearly. There we go. I'm going to go ahead and let Elise have the screen. I'm going to go ahead and have the mic to her and shut off my video. I pop back in via audio and video after Elise's presentation so we can get to the questions you have. With that, enjoy today's presentation, and thanks again for being here.
Great. Hey, everyone. Thanks for joining today. This is $4's Charity Care 101 presentation. I'm excited to share it with you and answer any questions that you have. So to get started, you heard our vision statement. $4 believes a medical crisis shouldn't mean a financial crisis. Unfortunately, you're here today because you know that this honestly isn't the case. 56% of Americans don't have the savings to pay unexpected bills. We know that medical debt represents about $195 billion in America, and it's the leading cause of bankruptcies. We also know that medical debt leaves people trapped in a cycle of sickness and poverty. What does that mean? It means that a lot of times having a medical crisis can push somebody off the cliff from a stable financial situation into poverty, but also being in a limited financial situation can prevent somebody from going to get the medical care they need, and thus exacerbating the situation. By the time they do get to the doctor, they may be more sick than they would have been otherwise, experiencing higher stress. And now that medical bill is higher because the interventions are higher. This cycle is particularly prevalent in communities of color, disabled communities, and non-Medicaid expansion states. So those are places where $4 focuses a lot of our work. That said, we're a national organization and we will help anyone and everyone with a hospital bill. So how do we do that? We do it through charity care. So here's the bottom line. Millions of Americans are on payment plans or declaring bankruptcy for bills they shouldn't have to pay. Why is that? Because the Affordable Care Act had a provision in it that said that all nonprofit hospitals must offer financial assistance programs in order to show a community benefit. So basically, those hospitals get a tax write-off for offering financial assistance to lower and middle income patients in their community. In addition to nonprofit hospitals, many for-profit hospitals and university-run hospitals and other hospital systems offer these financial assistance programs. Here's the problem. The hospitals hold all the power. There's really very limited regulation in this country about enforcing these policies. They must exist, but each hospital gets to set their own policy. They get to notify patients in the lowest effort way possible, those tiny words on the bottom of a bill, or a web page hidden on a website, or a teeny tiny sign in the lobby. They can also make it really hard for patients to apply for financial assistance. That can mean that a patient has to mail in a whole bunch of paperwork to the hospital, copies of bank statements, tax forms, or they might have to fax it. Show of hands here. How many of you have a fax machine in your home? Not many. It's a tall order. And we also see that hospitals aren't always fair in how they apply policy terms. They can use a lot of loopholes or vague or complicated wording to prevent people from getting financial assistance. And in fact, we've assessed a lot of hospital policies and found you have to be a PhD level to be able to read them. So that's a real challenge for a lot of people. But these programs and these discounts do exist. They're called charity care. The hospital might use a different name for them. Might call it hospital financial assistance, might call it financial aid, or discount programs. But these things are out there, and patients have a right to them. If they qualify, a patient's bill should be waived completely or at least discounted heavily. Now, each hospital gets to set their own eligibility guidelines. So they're often going to consider how big is the patient's income and how big is the household that the patient lives in. So they're going to use those two numbers to calculate the patient's federal poverty level. Are they at 100% of the federal poverty level or 300% of the poverty level? There are charts online that can be used to figure out where you fit in the federal poverty level based on your household size and income. They're also going to consider the age of the bill. They're only going to have bills qualify for a certain amount of time. We'll talk about what that is. But these programs are a lot more generous than most people think. They see that line about financial assistance and they assume I must be impoverished to qualify. That's actually not true. $4 has a database of every financial assistance policy in hospitals across the country, and these are the averages. On average, a family of four making $100,000 is going to qualify for a discount at most hospitals in this country. That means most of America is going to qualify. And if you have a hospital bill, your first step should be seeing if you qualify for charity care at your hospital, because you may never have to pay that bill, and you don't have to feel the stress of that bill if you don't have to pay it. Okay. What's the timeline? 240 days is the law for nonprofit hospitals. That's about 9 months. So that timer begins the date the bill is mailed to the patient the first time after they get out of the hospital. Not the insurance EOB, not a vague estimate of the amounts, but the actual physical bill of how much the patient owes the hospital, which often happens after the insurance is settled. So sometimes this can be months and months down the road. That is the beginning of the 240-day window, and patients have that much time. Now, that law doesn't apply to for-profit hospitals, so they get to set their own rules, but 240 days to a year is a pretty common window you're going to see at a lot of hospitals. The trick is that hospitals also are allowed to send a bill to collections after 120 days, which means you might be told your bill is going to collections, even if you still qualify for charity care. If you apply for charity care and you are approved, they have to pull that bill out of collections and waive it. So please don't treat collections as the end of the road. Now, if you have a bill that's 3, 4, 5 years old and in collections, it's unlikely to qualify. But for those newer bills, don't give up hope. Hospitals can sometimes also consider other elements, and this is where the law is vague and where hospitals are creating loopholes. There's not much we can do about these, but we just want to raise them as things to look out for. Some hospitals will only cover uninsured patients or their own squishy definition of underinsured. So that can be tricky if you have insurance and still have a high deductible and a high bill, but it really depends on the hospital and their particular interpretation. Some hospitals will consider where a patient lives. Are they in the state near the hospital or not? Some will consider the bill size, especially the bill size relative to your income. So you may be higher income than their qualifications, but if your bill is 20% of your annual income, you may qualify for a hardship discount. And then some hospitals, and this is rare, but it does happen, will consider immigration status. But we would say that's actually pretty rare and not a huge barrier to consider. So most of the time to apply, a patient has to complete an application that's like a PDF document that they're going to print off offline, and they're going to have to send in a whole bunch of documents with it to prove their income. And then those applications can be submitted by mail or fax or sometimes email. It really depends on the hospital's rules. In terms of required documents, the hospital's typically going to require your most recent tax returns, 3 months of pay stubs, 3 months of bank statements, and sometimes more, sometimes less. Again, every hospital has different rules, and this really varies, but this is a good ballpark to expect. This is kind of within the realm of what we see as reasonable. Now, that said, if you don't have some of these documents, it doesn't mean it's the end of the road, but it does mean that if you do have these documents and you don't share them with the hospital, it's unlikely they're going to forgive your bills because they want proof of your income before they're going to proceed with giving you financial assistance. They want to really make sure that you can't afford the bill. So who is Dollar4 and what do we do? I've just told you about this really hard process, right? It doesn't sound super fun, super easy. You don't want to do it on your own. I get it. That's why we're here. First thing to know, Dollar4 services are entirely free. We're funded by donors and foundations. We're not in this for any reason other than we believe that charity care should be accessible to people. So if you come to us for help, you're not going to get charged a fee. We're not going to sell your data. We're not going to do anything with it other than help you crush that bill. So the magic question is, do you have a hospital bill you can't afford to pay? If you do, Dollar4 might be able to help. Here's what you need to do. You need to go to dollar4.org/needymeds. And what you'll find there is a website with this screening tool on it. This set of questions, so you're going to pick your state, and then after you pick your state, you're going to be able to pick your city. Then after you pick your city, you're going to be able to pick your specific hospital, and you're going to want to be very careful to pick the actual hospital you visited. Then you're going to tell us, when did you get the bill? How much you owe to the hospital? What's your income annually? How many people live in your household, and your insurance status. Now, you might have lots of questions about each of those things and how to define them. You'll see a little question mark on the screen next to each of those things. Click it for a nice long description of exactly how you should interpret that question. I'd also note up here, You'll see that the language is in English. It can also be in Spanish. All of our services are 100% bilingual. You fill out that simple set of questions and you're going to get told immediately. Good news, you qualify. About 70% of people who use our screener qualify. If you don't qualify, don't worry, we're going to give you a lot of resources of what else you can try instead. At this point, $4 won't be able to help, but we will point you to places where we think you can get help. If you do qualify, you're going to give us some information. You're going to give us some contact information, and then you're going to fill out a longer form that's going to tell us your income, your details about your bill, details about your assets, and those documents. We're not going to use them for anything other than submitting them to the hospital to get you approval. We're not going to sell or share that data in any way, shape, or form. But once you've uploaded all of those documents and completed your form, you're going to get this screen. Congrats, your patient form is complete. At that point, it's going to take us about 4 weeks, and we're going to prepare and submit that financial assistance application for your hospital directly to them. We're going to use the hospital's custom form. We're going to use all your data, and we're going to make sure it gets to the right place so that your application gets completed. And then we're going to follow up with you for about 8 to 16 weeks, and we're going to help you figure out if the hospital approved it. We're going to give you tips on calling the hospital. We're going to check in with you every week or so. And we're going to get you a resolution. And look, it works. Here's some pictures of patients who have gotten bills forgiven. We last year crushed over $15 million in medical debt. And since 2019, our total is 38 million. We're going to hit 39 million probably in the next few days. And we're happy to help you. So if you have any questions, please let us know. We're here for you.
Elise, can you hear me? Just want to make sure you can hear me.
Yep,
And can you see my screen as well?
I can.
Fantastic. Let me just say, and I can see comments coming in, I am absolutely blown away by a number of things. First of all, by the powerful and straightforward mission of $4. I can see that you and your team went above and beyond to make this as clear as possible, explaining specifically what charity care is and how to go about getting it. I love the way, and Needy Meds is so excited to share this with the population we serve. I do see some questions coming in, and as Elise said, and we said in the beginning, if you do have questions, go ahead and submit them. You could do so by typing them into the chat, the Q&A section of your Zoom control panel. Before we get to those, I want to remind everybody that Needy Meds is also here as a source of support. I appreciated so much, Elise, at the end of your presentation, how you mentioned that about 70% of the people that turn to $4, you're able to crush those medical bills for, which is a shockingly large percentage, and that's wonderful. And you humbly shared that, since you can't crush medical bills for everyone, you will be able to refer those that you weren't able to do so to other resources. And we can say the same here at Needy Meds, and it's something we're proud of, that we are able to partner with other nonprofits such as $4. Something that Needy Meds has accepted as well, which is a hard pill to swallow, is that we also can't, unfortunately, be the solution to everybody's healthcare savings problems when they turn to us. But that's why we partner with other organizations to make sure that if you turn to Needy Meds and we can't fulfill that need, that we'll be able to be creative about what we can do for you and refer you to other partnering organizations. Just a reminder that you're looking at on your screen right now are the healthcare savings resources Needy Meds offers. So if you are having difficulty affording your medications or other healthcare expenses, check out our website. Under that healthcare savings tab, those are all the different categories of ways that you can save on your healthcare expenses. And as I said in the beginning, we also have a toll-free helpline, 1-800-503-6897, if you can't find what you need on our website. One thing I also like to mention is under that healthcare savings tab, you will also find a link to federal poverty level. Elise spoke about oftentimes there is the criteria to be eligible for some of these charity care programs includes what your income is based on the federal poverty level. And we do have a link on our website that can help you to figure that out. But if you are interested in learning more about the healthcare savings resources we offer, check out our website, give us a call, or sign up for one of our upcoming overview Needy Meds webinars. They're about a half hour long, and they showcase and do a little bit of a deeper dive into what all of these programs are. So let's get to those important questions. I see a bunch coming in, and we do, as I said, keep the question segment brief. So don't worry if we don't get the chance to answer your question. You will hear from us or one of our team members as soon as we can. But we do encourage you to reach out to the websites on your screen, which are dollar4.org/needy meds. And Elise showed the screenshots of how easy it is to go about completing those pages on the dollar4.org/needy meds site so that they can help you. And of course, if you'd like to learn more about healthcare cost savings resources that we offer, visit needymeds.org. So Elise, it was so great at the end of your presentation. You showed examples of individuals and families that Dollar4 was actually able to help, and the really high hospital bills that, using your terminology, Dollar4 was able to crush. One of the questions that came in while you were giving your presentation is there a particular patient story that really sticks out for you?
Sure. I'll talk to you about Jarrett. Jarrett was a patient with cancer. He had bills totaling, I'm going to get the number wrong off the top of my head, but somewhere around 140 to $160,000.
Wow. Wow.
Jarrett filled out our forms. We submitted them, and I think he really didn't believe it was going to work.
Probably.
It was like a thing he did, right? Like as a well, let's see if this works. And then we followed up with him like 3 or 4 weeks after we had submitted the application. Our system sends an auto message out to the patient. Hey, what's going on? How is it going? And he wrote back and he said, so I got this letter, and he took a picture of it, and this is all via text. And he said, is this real? Does this really mean I don't owe anything? And we looked at the letter and we said, yeah, your bills are gone. But it took him a while to believe it, right? Because what does it feel like when one day you owe $140,000 and the next day you don't?
I can't imagine. The first thing that comes to mind is freeing, very
Yeah.
freeing.
Yeah. And that is something that we hear from a lot of patients is just this like, oh, now I can breathe. Now I can go pay for graduate school. Now I can go buy a house. So those are the stories that stick with me the most, or the ones where like the relief comes through, and the vision of what their life is going to be like after this bill comes through.
Wow. And that is really a very impactful, powerful, and inspirational story. And it perfectly showcases what Dollar4, the magic that Dollar4 can work. And, it is unfortunately, I guess, super relatable because, as you said in your presentation as well, which I was shocked to hear, that you guys have found that an estimated 56% of Americans don't have the savings for an unexpected bill.
Right.
And,
Yeah.
to a certain extent, it's comforting because I know I'm not in this alone, but that is a high, really high statistic that does shock me. And it is unfortunate because exactly as the language that is used in Dollar4, very oftentimes medical crises turn into financial crises, and it puts everybody's life on hold. So this is really something we're excited to share, as I said, with Needy Meds users. And for those of you joining us, hopefully Dollar4 will be a solution for you, but please spread the word with your loved ones, your neighbors, your friends, and even your patients and your clients, because there's a lot of people that probably can use this assistance. So another question that
Oh, Carla, I think you muted. I can't hear you.
I did. I went ahead and muted myself. Sorry about that. I don't think I've got one presentation where I don't do something like that. So that's out of the way. Um,
No problem.
but you talked about how hospitals do have these policies according to the ACA, the American uh,
The
uh,
Affordable Care
the
Act.
Affordable Care Act,
Yeah.
but that they're kind of hidden, quote unquote. So one of the attendees asked a great question, which is, what could hospitals do to make charity care easier for patients?
Yeah, I mean, there's tons of things, and I don't want to say universally that every hospital is doing this terribly,
Right.
right? Every hospital has their own way, and there are some good things about it, and there are some probably not great things about it. Dollar Four is looking towards a future where presumptive eligibility is the way. We dream of a time when you walk into the hospital while you're getting treated or while you're checking out, you answer a few quick questions, you give
Mhm.
the ability to, do a income verification of some kind, and the hospital runs it and determines if you're eligible. Beyond that, there's lots of different ways. Hospitals could be making it bigger on the bill. They could be sending a copy of the application directly to the patient alongside the bill. They could be setting up email addresses or online forms where patients can apply. They could have counselors reaching out to patients or social workers. There's so many different ways that we can think of to get these existing programs to the people who need them. I think the biggest problem is that people see the words about financial assistance or the words charity care, and they assume it does that it's for somebody else, not for them, right? But
Absolutely.
lots of people need this. So that's therein is the big one. Like, what if a hospital just told you if you're a family of four and you make under $103,000 and 45 cents this year, you qualify? If you saw that number, would you do it?
Right, right. Wow, that was such an important question and a great answer. And it's almost endless. What can hospitals do to make it um, easier for patients? And as you talked about, just the visibility of it, they can start with that. And I'm also glad you had an opportunity to talk about people maybe assuming that you see, and I've done this prior to working at Needy Meds, where I would see financial assistance programs or nonprofits that can help me with medications or medical bills, and I make the wrong assumption that I wouldn't qualify. One of the many lessons I've learned since working at Needy Meds is, in addition to advocating for yourself and not being afraid of asking questions, even when it comes to bills, that don't be presumptuous about what you may or may not qualify for. We have at Needy Meds, at least I've seen over the last few years, a lot of programs that existed to help people afford or save on their medications or other healthcare costs. And actually, the eligibility criteria has expanded. So it's worth a shot. It's always worth a shot. And that segues actually into another question that came in, Elise. And I think we're going to wrap it up with this question. But as I said, don't worry if you ask a question and we don't get the chance to answer it today. We will absolutely follow up with you. But again, check out dollar4.org/needy meds and visit needymeds.org when time allows. Check out that healthcare savings tab to see if there are other programs to help you save on your meds and other healthcare costs. So the last question, and I think it's a great one to wrap up with, what should a patient do if they don't think they qualify for charity care? Great question.
Yeah, well, the first thing to do is check because you may think that, but you might be wrong. And like we've said, go to dollar4.org/needymeds. That eligibility screener that I showed, those few quick questions, that's all you need to do to check. It doesn't hurt. You don't even have to give us your name or contact information to check if you are eligible. You can be entirely anonymous and use that screening tool to check if you're eligible. And then if you do determine you're eligible, get help. If you use that screening tool and you are told you're ineligible, you are going to get a link to a list of resources to other ways to get help. You can give us your contact info and we'll email and text it to you, or you can just click the link right then and there. On that link, what you're going to find is a couple of for-profit companies that actually do negotiation. These are companies that Dollar4 has vetted and feels comfortable recommending. We do not have a financial relationship with these companies. We just think that they're the best option if you need to negotiate your bill down and you don't feel comfortable doing it on your own. You'll also find on that website advice on how to do it on your own. If you'd like to do it that way, by all means, do it, do everything you can to get that bill lower. There's also a number of other organizations that you're going to see listed there for different cases. So if you are a patient that has been diagnosed with a chronic disease, the Patient Advocate Foundation is a large organization that can help advocate for you, negotiate your bills, help you navigate insurance, things of that nature. Patients Rising is an amazing organization that helps patients find resources in their community that are relevant to their particular health needs. And I feel like there was, I always like to mention the Leukemia Lymphoma Society. If you are diagnosed with leukemia or lymphoma, they're a great resource. But there's a number of resources on there, all worth checking out. And of course, all of the resources listed on Needy Meds.
Wonderful. Thank you so much. And I also would like to mirror that sentiment. Don't hesitate to visit needymeds.org or reach out to one of our call center counselors, because just like Dollar4, if Dollar4, it turns out you're actually not qualified and they will provide you with other resources that may be able to help you, that's the same at Needy Meds. Our goal, of course, is to connect our users with programs that will help them afford or save on their medications and other healthcare costs. If we are not able to meet that need, we do have partnering organizations we can refer you to. The other thing that is worth keeping in mind is we may also be able to connect you with other healthcare savings options that you didn't even know existed, or maybe you weren't turning to Needy Meds for. For example, maybe you're looking for help affording a specific, very pricey brand name medication, but as perused our website or in the conversation you had with our expert call center counselor, you realize that we have discount programs for other of your medications or healthcare needs. And that's great to take advantage of, because then it at least alleviates some of your burden. So just like Elise encouraged you to visit dollar4.org/needymeds and see if you will be eligible, and if not, they'll refer you elsewhere. Needy Meds can do the same for you as well. So as I said, we're going to keep the question segment relatively brief, but I want to extend a big thank you to Elise for taking time to share her expertise with Dollar4 with the Needy Meds audience. We're very excited, as you can tell, to be partnering with them and spreading the word. This is invaluable, and we're very confident it's going to help a lot of individuals and families that we connect with. And to our audience for joining a Needy Meds special topic webinar. And I do hope you share what you learned today with your friends, loved ones, neighbors, patients, or clients. We do convert our webinars and presentations into videos and upload them onto the Needy Meds YouTube channel. So subscribe to them, because it's a great way to rewatch presentations that you'd like to revisit some of the information that was covered. You can also share the webinar link of the video with others that may be interested. And if you subscribe, you'll be notified when new webinars, presentations, or videos are uploaded. It's a great way to ensure that you don't miss out.